Today we're going to cover the 3 most common reasons why you might notice yourself shifting or rotating while you're doing some sort of squat variation. The reason number 1 might be stiffness in one hip versus the other. For example, if my right hip is a little stiffer than my left, specifically in deep hip flexion. When you're squatting, you have to go into deep hip flexion and have adequate range of motion on both hips to sit equally down into the squat. If one hip is stiffer than the other, what'll end up happening is when you squat, you're going to shift or rotate away from the stiff side so you can load the other one deeper because this one doesn't have the range of motion. So sometimes a shift or a rotation will look at the side that you are shifting away from on that hip to make sure that you have adequate range of motion to get deep down into the squat. The second reason why you might be noticing a shift or rotation when you're squatting can actually be from poor ankle mobility. If you're squatting and from a side view, you start to pick up in a video that, okay, one knee doesn't go quite as far over your toes as the other knee. Or you notice that one tibia is more vertical than the other when you're squatting. That might indicate that your ankle mobility needs some improvement, or that you just need to learn to let your knees go over your toes while you're squatting. One easy check that you can do is throw some plates down on the floor and elevate your heels when you squat. So if you squat with your heels elevated and you're able quite easily to fix the rotation so you're no longer getting this rotation as you're squatting, your ankles might be something you need to pay close attention to in terms of their mobility. Reason number 3 why you might be getting this rotation is when you squat, especially at heavier weights, you notice that you're shifting to one side. But at lighter weights, everything seems to be okay. It could be a strength discrepancy. Sometimes if you have a previous injury that you recovered from but you didn't rehab it completely, you can have a strength deficit on that side. Honestly, sometimes it's even just a habit that you've learned after a previous injury. For example, if you're squatting and light weights, you're good. Everything's nice and symmetrical. As you start to build the weight up, you start to notice this shift over to one side. But you're not really having any pain. It could just be a strength deficit, and you might have to drop the weight down and focus on tempoed squats, meaning doing 2 or 3 seconds in each direction of the movement to really nail down that symmetrical squat. So as you build up the weight over time, you're then able to maintain that symmetry at heavier weights. And the 4th most common reason is potentially due to some type of pain or injury. So if you are dealing with hip pain, and every time you get deep into the squat, you start to get this hip pain that comes on, it's your natural tendency for a lot of people will be to shift away from it, to offload it. And that's just because it's painful when you get down there, so your body's trying to adjust so you can still do the squat, but it's less painful. So the solution to that might not necessarily be to focus on addressing a mobility issue or a strength issue or anything like that. It might just be finding an alternative variation of the squat that's tolerable and then working your way back to it over time after you've either recovered or rehabbed from the injury that's preventing you to do it symmetrically in the first place. So if this is content that you loved, you learned something from this, please hit the like button, hit the subscribe button, come on back. We're going to be posting more content on rehab and strength and conditioning. So hopefully we'll see you in the next one.